the full form of PMDD is Premenstrual Dysphoric Disorder. Okay, so what happens over here is it's similar to PMS. The only thing is it's very severe, like severe to a degree where it impairs your the quality of your life. Okay, it's again similar to PMS, where it starts just a couple of days after your ovulation or a few days before your menstruation cycle, and it continues into your periods for a couple of days. But over here, considering the intensity is different, that is why it is the term dysphoria. So what is dysphoria? Dysphoria is basically opposite of euphoria. So you have a profound sense of unease or dissatisfaction. You feel anxiety, restless, irritable, but all these symptoms are to a whole new degree. Like, to actually differentiate between a symptom of PMS and PMDD, in PMS you might feel depressed, but then in PMDD it goes to an extent where you feel hopeless. You might end up having even suicidal ideations. Okay, and in PMS, if you have a bit of anxiety, in PMDD it will be extremely tensed or on an edge at all times. So these are the differences. Like PMS, there is a chance that you can still carry on with your social and occupational life to a certain degree. But when you are experiencing PMDD, it is at a much severe level where you just simply are too impaired to work on it and to carry on with your otherwise life normally. That is like one huge difference. And another reason, like another thing where PMDD becomes a really intense thing is when, it's confused with depression. So that means the symptoms are very similar, severe. So what happens is, the reason why there's a confusion between these two is the core symptoms of PMDD and depression are quite similar. So the core symptom of depression are lack of motivation, fatigability, or low mood. This is exactly true even about PMDD. Then even the minor symptoms that you face when you have depression is something that you see in PMDD as well. For example, irritability or sleeplessness, disturbed sleep, loss of appetite, or any of those things. So because this similarity is there, there is a high chance that we ourselves might also confuse with with which one is which. But there are certain ways where you can definitely differentiate between the two. And one most easiest way that you can recognize the difference is PMDD is, of course, it matches to your monthly cycle. So it has a monthly pattern. It's that set duration when you will experience all these symptoms. On other days, you will feel quite normal. Then other cause would be, so now the exact cause of PMDD is not known, but it is definitely associated with the abnormal response to the hormonal changes that a woman goes through when she has her periods. But in case of depression, there can be various number of reasons. Like, it can be trauma, it can be drug abuse, it can be family history, or any other medical condition as well.
Yeah, actually the funniest thing is that PMDD, so we've got two diagnostic manuals, right? There's one that's DSM-5, which is used by the American Psychiatric Association, so mostly in the States, and then there's one that is by the WHO, which is ICD-10, which is what we use over here in India. Now, the funny thing is that DSM-5 mentions PMDD as a disorder, okay, but ICD-10 doesn't. So it's not considered, whoever is using ICD-10, whichever country is using ICD-10, PMDD is not a valid diagnosis. Why? Because it's not mentioned. So now, think about it. If it's not a diagnosis, it's not something that's in the official manual, how will you diagnose it? How will you teach it? Right? It's quite flawed, very flawed, if you ask me.
Is there any particular reason why that is? Like, shouldn't it be uniform, ideally?
So if we get into the whole DSM, ICD,
okay.
It's like a different story altogether. But yes, it needs to be okay. So it needs to be updated, and the people that are in charge of making the decisions of what goes in, there needs to be diversity. It needs to be inclusive. And we actually did a video on this about basically LGBTQIA, and in that also we mentioned the same thing, that if cisgender white men are making the decisions of what is a disorder and what isn't, then how diverse is that? How inclusive is that? And we here are women. I think we are more qualified to talk about these things. And then again, depending on the region you live in, depending on the country you live in, everything is going to change according to, once we have the statistics and all. So yeah, that's very important.
We call a patient, the ACOG, which we do follow in India as well, the American College of Obstetrics and Gynecology, says that if you are having these symptoms for 5 days before your period, or at least 3 cycles, then you are labeled as a PMS or a PMDD person, depending on the symptoms you've been having. And there's not been enough research. Like she said, it's a bunch of cisgender white men at the top doing that research. So there's not a lot of research that has been done. But from whatever has been done, it's understood that everyone's hormones, every female person's hormones drop towards the end of their cycle. And it's just on an individual sensitivity to those hormones. So estrogen and progesterone, which are our female hormones, once they drop, they also tend to affect the mood hormone, also called as serotonin, which is implicated in depression and any mood disorders. So it depends on how your individual body is sensitive to the levels of all these hormones that you experience these symptoms. There's no spike in any hormone, there's a drop, and if your body can notice it, then you have PMS. So period pain may or may not be related to your PCOS. Your PCOS is something that has to be addressed separately. Period pain happens because your uterus is contracting, and that contraction, that period pain contraction is similar to like a labor contraction, but on a smaller degree, because the size of your uterus is very small, like compared to a pregnant uterus. So that pain is referred pain. It can be in your belly, it can even radiate, or patients can also have pain in their vagina. It can be on the outside, also on your external female genitalia. So all that pain is normal. It's part of your period cramps, and a medicine that would work on your period cramps can also work on this. Secondary dysmenorrhea is if you've had painless periods in your life and now you've started having painful periods because of some other reason, then that painful period is called secondary dysmenorrhea. It's due to a cause that is not exactly from the uterus itself.